peering at people on the far side of the room. Can I just check first that we're getting the sound through, everything's working on the webcast? Yes? All good? Okay. Thank you. So can everyone just be aware that this meeting will be webcast and a record will be retained on the council website for up to 2 years. And by participating in this meeting, you are consenting that your name, the content of what you say and your image will be broadcast and stored to the council website. For those in the public audience, your image will not be directly broadcast unless you are registered to speak, but you may be indirectly captured on the stream. If any member, officer or member of the public has concerns about this, please contact committee services immediately. So as I say, for those of you at home who are viewing the webcast, if you look above the video, you'll see a resources tab. Select this and the link to the agenda will appear in the right-hand side. That means that you can then open the agenda in a PDF form and follow the discussion and the debate. Members are reminded to please turn their microphone on when speaking to ensure that the audio is captured. And it is important that you do that, members, because that also will bring the camera to you when you're speaking. So please do remember to do this. Now then, with the agreement of myself and the party spokespersons, we have discussed, this is a very big agenda tonight, extremely large agenda, so we are hoping that we will try to get this meeting done in 2.5 hours, if we possibly can. Although, obviously the guillotine on this committee is 3 hours, so there is a little bit of wriggle room, but hopefully we won't need to use that. So in order that we don't have to keep you here too long, we would ask all of you, please, if the officers who are presenting reports can be as brief as possible. We have got your reports, we have read them, so please don't feel that you have to repeat everything that's in there. You should assume that members have read your reports, and please add any additional comments that you need to. But please try to be brief. I could ask members similarly. I appreciate how difficult members find it to be brief, but if you could try and be not to simply speak in order to say, I agree with whoever, the last person who spoke. Let's assume that if we don't hear from you, you agree. And if you need to speak, if you disagree or have something different to say. So, as I say, it is a very large agenda and there is a considerable amount in it. And that they are very, very interesting reports, which took a great deal of time to read, but well worth the effort. We have arranged an additional meeting for this committee on the 29th of July at 6 o'clock, basically because myself and the spokespersons felt that waiting until September to leave a 2-month gap with the amount of issues that come before this committee was way too long. And we'd have ended up having to bring our pyjamas, I think, to the September committee if we'd done that. So we're going to have a committee on the 29th of July. So, having said all of that, we'll move on then to any apologies for absence. None? Thank you. I should also say in relation to masks, please do, if you wish to pull your masks down when you speak, because it's certainly difficult, I think, to speak through a mask and probably going to sound all muffled. Do we have any declarations of interest? Councillor O'Hare.
Yeah, I work for the NHS.
Councillor Cottier.
A director of a construction company currently working on 2A Price Street Life Cafe for NHS. Sorry.
Working on?
The 2A Life Cafe in Birkenhead for the NHS.
Thank you. Councillor Jordan.
Thank you, Chair. I work for the NHS. My son's a GP with the NHS, and I'm a trustee for Inky Babies.
Thank you very much, Chair. So, declaration of conflict of interest. I'm the senior partner at Heatherlands Medical Centre, which is a surgery in Woodchurch. I'm also the local medical committee secretary for Mid Mersey Local Medical Committee, which is a statutory representative body for general practice. And I'm also the GPC representative for Cheshire and Mid Mersey. I'm also the BMA chair of the Community Care Committee, and by way of that, I'm also a member of the BMA. My wife is an advanced nurse practitioner in Ellesmere Port. Thank you.
Thanks, Chair. I've got a member of my family who works for the NHS, and another member of the family is an employee of Wirral Borough Council Children's Services.
Move on to the minutes of the meeting from the 2nd of March. Can I have somebody to move those as accurate?
So moved, Chair.
Thank you, Councillor McLaughlin. Have a seconder?
Seconded.
Councillor Cannon, thank you very much. Public questions and statements and petitions. Now, we do have a petition I'm aware of, and we also have a statement from the Unison Branch Secretary. He's going to speak after after item 5 on the agenda, and I believe Mr. Lamb, who's going to present the petition, is going to speak now. So, Mr. Lamb, welcome to the committee, and you have 1 minute to outline the aims of your petition.
On behalf of my family, I'd like to thank the committee for hearing our petition today. The aim of our petition is simple: to keep Highcroft Day Centre and all other day centres governed by Wirral Evolutions open. In the space of just a week, over 1,030 people have signed our petition. We put it to the committee that these day centres play a vital part in the lives of the vulnerable people who use them. They provide routine and security, and most importantly, an opportunity to socialise. Day centres make service users feel part of their communities and support their mental well-being. The people and staff they meet at these centres are more than just carers and friends. They are a second family. The centre also provides their families with much-needed respite, some they would otherwise not have. We believe there must be an alternative solution that will allow these day centres to remain open. We and our 1,000 plus supporters urge the committee and Wirral Evolutions to find such a solution. Thank you.
Thank you very much, Mr. Lamb. The committee will note your petition, although you need to be aware that the committee is not taking any decisions this evening. We're hearing a progress report from Wirral Evolutions, but thank you for the petition. We will bear that in mind. Thank you. Right, we move on then to item 5, which I understand is being presented by Jean Stevens, who's the Managing Director of Wirral Evolutions.
Thank you. The purpose of this report that you've got in front of you is to provide elected members with a progress update in response to the financial challenge set by this committee on the 18th of January 2021, to ensure that the service is within the commissioned contract value price for 2021-22. Also, as part of the company's submission to operate within the commissioned contract value available, we made a business decision to modernise the operating model based on our mission, vision, values, which are outlined in the company's 5-year strategy, which was attached to this report. In doing so, the company subscribes also to some guiding principles as detailed in the report on page 12, paragraph 3.6. And I note, Chair, that you want us to take that the reports have been read. Our proposal involved two key elements, which are also detailed in this report on page 12, paragraph 3.5. First element was an organisational restructure, enable improved personalised outcomes for the people we support to reach their full potential. The second element of the proposal was to consolidate locations, working towards providing an improved community integrated offer for people with learning disabilities, supporting more independent life skills. Together, this will enable greater personalised outcomes based on the needs of the people we support, smaller ratios based on levels of support and their needs, greater social value and benefits for the people we support, a leaner and more modern outward-focused workforce that will see a reduction in management posts, the creation of community pathways advocates, and the creation of group leaders working in a smaller ratio of 1:6. It will also enable consolidation and greater economies of scale of assets and resources, and working towards that community integrated offer as mentioned above, in more specialised and community hubs and day experience provision. It will also improve the efficiency of day services generally. Our proposal also details several assumptions, which is outlined on page 13, 4.1 and 4.2. And those assumptions were around transition and the impact of COVID-19. And it would create a budget pressure for the company. A subsequent report has been prepared and submitted to the Council's Shareholder Board Officer Group to request support on the budget pressure due to factors outside the company's control. A response remains outstanding at this moment in time. The engagement and consultation process, which is an update on page 15 of this report, part 1 was a formal organisational restructure. The workforce consultation was launched week commencing the 22nd of March and closed 7 weeks later on the 19th of May 2021, in accordance with Wirral Council's HR processes and procedures. Formal weekly engagement meetings also took place with trade unions throughout that workforce consultation process, again supported by Wirral Council HR resources. No formal alternative proposals were received by the company by the trade unions during that process and that period. The second part of the consultation engagement is with people we support, parent carers, advocate groups, wider stakeholders. That commenced on the 24th of May 2021. This involves a series of Zoom sessions. So far, we've had 105 parent carers take part in the sessions. Online survey. So far, we've had 92 submitted, mainly from the people that we support. And will have taken place after the 13th of June, personalised conversations and meetings with people we support and their family support groups. Wirral Evolutions do recognise the levels of anxiety through change and modernisation, and through the Zoom engagement sessions we've had some themes that have been emerging, and I'll share with members some of those themes. Transport. Will transport be available with the new locations? Staffing. Will staff structures support the same level of capacity? The staffing structure sounds a positive way forward, offering more focused support and also acknowledging the hard work of the staff within the service. Service provision. Will existing levels of service alter? Will we get the same number of days? It is reassuring that people are at the centre of the decision-making process. It's excited about new opportunities, options, as the service has stagnated in previous years. Transition. Will there be an opportunity to see other locations and other centres and other opportunities? Can the staff support this transition? Buildings. If you reduce some of the buildings, will there be enough capacity for everyone? Some of the buildings need investment, pace of change. How long will people have to have as part of the transition? And do people have to move if it's age-related? Community integration. Can you give us more examples of what you actually mean about community integration? Once all the consultation period is completed and all the feedback is collated, this will support the decision-making process And then personalised meetings will take place with the people we support, their family groups, to ensure individual needs and opportunities are explored. At this point, I'd like to stress that no individual within Wirral Evolutions who are currently attending or are registered will receive a reduced level of service. In conclusion, Wirral Evolutions are totally committed to enabling the best outcomes for the people we support by enriching their lives, maximising their personal potential. And this you have witnessed through our annual report and supported pathways impact report, which are contained in the large documents, and I do apologise, on pages 17 to 28 of this report. And to continue on this good to great journey and pave the ways for greater opportunities, the company would welcome the committee to support the commencement of a parallel review of the existing specification in preparation for a new 5-year outcome-led contract from April 2022, further to other decisions and assurances from this committee. I do thank you for listening and welcome you all to visit and witness for yourselves the amazing people we support, their talented and the dedicated workforce and volunteers, parent carers, charity groups, who all make a difference to people's lives every day. Once again, thank you for listening, and I do ask that the committee note the recommendations 1 to 6 that's contained in the report. Thank you, Chair.
Right. Thank you for that. Any questions from the committee? Councillor Camphor, then Councillor Gilchrist.
Thank you, Chair, and thank you, Mr. Stevens, for your very helpful description. I think I'll take this off. I have a number of questions, and I suppose because I'm new here, and I apologise if I'm asking questions that have been asked before, but I understand in November 2020, the operating model contract value of 5.05 million was reduced for the year to by 0.5 million. And what I wanted to know was, what was the basis for it, and what was the background to it, and was there any oversight by the local council to ensure that services that you're providing, which obviously are very good and helpful to all the patients in the community, are provided in a fair and not at risk basis? That's my first question.
Thank you, Councillor Camphor. In terms of that question about the funding, I'm going to ask the Director to clarify that for you.
Thank you. The contract price for the previous financial year was 5.1 million also. The spending of Wirral Evolutions was over the contract price. So it has been over for a number of years, and each year we've been trying to come back within the contract price. Clearly, with COVID, there were extra costs that Wirral Evolutions were faced with, so they were unable to bring their services back into contract price last year, and they've been able to come forward with plans this year to be able to do that.
Chair, can I come back? Okay, thank you. So I understand the financial constraints on the local council. However, I understand that this is a local authority trading company, so it's an arm's length company for the local council, and therefore, when it was set up in 2015, it should have had oversight from the local council over its finance and budgeting. And why was it left so late in November to reduce their budget by $500,000, which is going to have a significant effect and impact not only on the patients who need this service, but also on the very good quality staff that they have who are providing this service, of which I think 30% will actually lose a job, and I think that is not really good. And I'm just wondering where the governance of all this is, and how is the local council accountable for running this arm's length body from a distance with their arms tied behind their back? Thank you.
Councillor Camphor, I think the Director has just explained that there was not a cut in the budget, that in fact their contract price has always remained the same. What would happened was that there was an overspend by Wirral Evolutions and that they were asked to reduce that overspend. I think it may be helpful if you have discussions with your party spokesperson, because there is a long history to this, and it has been to adult scrutiny on a couple of occasions. Just before I ask the Director to come back, Councillor McLaughlin may well have something to say there.
Thanks, Chair. Yes, I do, because I chaired the Scrutiny Committee, it's 2 years ago, isn't it, when we had a special session devoted to looking at Wirral Evolutions, because we had concerns about some of the issues, not ever about the quality of service. That has never been an issue. It has been about the governance and the finance arrangements. It wasn't a particularly satisfactory exercise, I have to say. And I know that since that time, there's been changes in the governance arrangements there. And I'm pleased to see a more detailed report coming back, and that the CEO, I'm sorry, is here tonight to present the report in person, because it hasn't been that easy in the past to have that level of communication with Wirral Evolution. So I'm pleased that we've got that going tonight. I'll be very interested, and I'm sure other members of the committee will be as well, to hear some of the feedback to those questions that have been asked by your service users, because they're obviously very, very concerned about the future and the future of those that are using the service. So, but just to clarify that, it wasn't the first time in November that we asked for information. We had been looking at it for some time, and we had had difficulty in getting that information that we wanted.
That helpful intervention. I'm just going to ask the Director just to clarify the arrangements that we have in the local authority around the shareholder board and the governance of our arm's length companies.
Yes, for Wirral Evolutions and for any other council companies, there is a shareholder board. The council is the shareholder, and that, in essence, looks at the sustainability and the governance of the business. It has elected members on the board. You mentioned before, Councillor, that the company is arm's length, and the issue here is that the company was created to be able to expand, go into new businesses, change its remit and all of those sorts of things in order to, in essence, continue to support people with disabilities, but also to develop as a company. So the shareholder board is there in place in terms of the governance, in terms of the audit and all of those sorts of things for the company. You know, as Councillor McLaughlin has said, there has been a long history here in relation to the financial situation. It's not a new scenario in the last couple of years.
There we are. I'll just take my mask off, Chair. Along with Councillor McLaughlin, I'd like to confirm that there were discussions, and certainly in February 2020, I chaired a panel which met with needing people from Wirral Evolutions to discuss some of the background issues. Certainly in the past and for the future, members had wanted the organisation to strike out and find new ways of working and bring in a whole raft of new service users with perhaps a different range of activities or opportunities, and we wondered how that was progressing. And I think that work had started, and obviously COVID didn't help. I may have turned to a letter which I believe was sent to all parent carers by Wirral Evolutions, dated May 2021, and which was sent to councillors. I think Lorraine Moran at Evolutions sent that to members, Chair. And in that document, it said that the engagement period will continue until June the 13th. So we're still a week or so ahead of that, but we've heard of concerns about Highcroft, and I'm wondering if Ms Stevens can give us some more information why the managers of the organisation particularly feel that withdrawing from Highcroft is a suitable option, and if that is continued with, or discussions carry on about that, can we as a committee get sight of all the consultation responses from users of the services so we can be fully acquainted with what parents and service users and carers are saying, so we get a feel for what can or can't be done in the situation? Thank you, Chair.
Okay, thank you. I'll just hand over to my colleague on the Highcroft response, and then Karen Smith, who's our Head of Operations.
Thank you, Chair. Thank you, Councillors. When we looked at reorganising the services, it really is around our physical footprint in terms of the determination of the locations we determined to come out of and relocate within other bases that we have across the Wirral. Highcroft as a location wouldn't have the capacity to take very many more people than it currently does. So that was one of the determining factors. Our intention and our vision is not to be an asset-based service as we progress into the future, but to be more a community integrated service. But we can't do that in 6 months. So we've got to look at relocating people, because part of us being able to achieve the £500,000 savings to come within contract price, we would need to come out of some of those spaces to make savings both on the premises and on management costs. So they were some of the drivers in our decision-making process. Cambridge Road was another location that we are not going to, we've proposed we would not be delivering a service from from September. However, that was, we were looking at relocation to the Liso development from there, so that was why that was still on the table for us. So it's really about where we could accommodate people safely and securely and deliver the services from, and we couldn't relocate enough people into the Highcroft Centre, so it's really about the physical footprint.
Chair, just to ask, can somebody kindly put a bit more flesh on what is a community integrated service, please?
Can I take that as well, Councillor Gilchrist? So what we want, the approach we want to take is really that we deliver our services within the community. If I give you some sort of examples, and I'll try to keep them brief because I know the committee. So, for instance, people we support may have an interest in taking part in activities, say, for drama and arts. At the moment, we deliver that from within the current day service in a building. What is our intention is we will connect with community groups in the local community, local theatres, amateur dramatic groups, other organisations and providers like ourselves, and we would deliver the drama and within that community group. Again, people we support, they may have an interest in working with animals or helping with animals. We can connect up with local animal sanctuaries, dog walking, dog groomers, all to connect the people we support into the community. I have to make the point, it is not suitable for every person we support. So there is a large group of people we support who have complex needs and will still require an asset-based day service where their needs can be supported and best met. At the moment, we have a specialist facility in Pensby Wood. As Jen would welcome any of colleagues around the table to come and visit Pensby Wood to see that facility. It is state-of-the-art. The council invested a significant amount of money a few years ago, over 1.8 million into the development of Pensby Wood. And we are looking to have a second facility in our eastern location which will support people with complex needs to a similar standard and level, but it will require investment, and that is something we've got to work through in our future plans. Because currently in our the group of people we support, we have set over 70 people who would be within the support criteria of PMLD and complex needs, and hence we can only support 30 of those people currently. So it is important that Eastham is developed to support. At the moment, we support people with complex needs in Highcroft, in Cambridge Road, in Oakenholt, and we're going to bring those resources that we've proposed to bring that together so that the support needs can be better met, and also develop staff and their skill sets and their professional development in the same way.
Thank you. I just want a brief answer, please. You said one of the reasons you needed to move was because you need to save on the cost of buildings. What do you pay the council for the buildings?
The overall saving of us is coming out of those two locations will be over £100,000 with the rent and the
rent?
Utilities. Yeah.
Yeah, you have those buildings at peppercorn rent, and they're maintained by the council. So, sorry, that's what the director tells me. Okay. Any further questions? Councillor Walsh.
Thank you, Chair. I just wanted to ask around the restructure questionnaire. That is, it's only open for parents, carers and staff. And as we've seen from the petition, there's a lot more people interested in the community. Why has it not been open to the community and the general public?
It is on our website, so we promoted it within the groups who we've engaged with. So I think we would welcome feedback from anybody who's got a vested or interest in this current situation. So.
Can I come back yet? So when you go onto the questionnaire, it asks for which user is using the service that you want to do it on behalf of, and not necessarily everybody might have a user. You might be considering using the services in future.
Well, I think we can easily have that amended this evening. Yeah.
I think that would be good. Thank you.
That's a great suggestion. Thank you. Thank you. Chair, can I just respond back to Councillor Gilchrist on the feedback? I don't think I answered that question. Thank you. Yes, as soon as it's closed, we're collating all the feedback and it can be shared with our responses to how we're going to mitigate against those questions as well.
Thank you, Chair. I've listened to this debate very carefully, and my concern is that the time period that's offered to the service to reduce its service is not enough, and that it will actually substantially put the patient care that they're offering at risk, and I'm just concerned about that, and I just wanted to voice that. Thank you.
I'll wave flags. Thank you, Chair. My concern is regarding the leaner workforce that you're proposing. How is this going to affect the skill mix when you're dealing with complex patients with some very severe needs? I just wonder what sort of workforce you're going to be left with if you're going to let people go.
It is, Councillor Jordan, going to be a very challenging period. We have got a very comprehensive personal training and development planning process. We've invested over the last 2 years significantly in staff and training and upskilling our workforce. Right across the workforce at the moment, we do have staff who currently support people with very complex needs. Of course, in any decision-making process around an EVRS scheme and the people who have applied, we will have to, take organisational need is a key component of that decision-making process, because we cannot leave ourselves with a lack of skills.
Thank you. Are there any further questions? that everybody? Vicky, thank you. Thank you very much. Thank you for that presentation. Thank you for answering those questions. And thank you for your progress report. Do I have anybody who wants, before I bring in Mr. Jones, who's going to make a statement, does anybody want to move on the recommendations? Comment on the recommendations? Councillor Gilchrist.
I know there are recommendations in the paper, Chair, but they struck me as being not something particularly that the committee would want to be addressing at this stage. I pondered on this. I'll read it out, and if members think it needs tweaking or want to challenge it, I'm happy. I would say that having received a presentation and heard the concerns raised by petitioners, committee welcomes the assurances that the organisation has given to date, but requests that they produce more detail on the outcome of the consultation for our meeting in time for 29th of July. And in so doing, the committee would like to hear how the consolidation, economies of scale and community hubs will be of genuine benefit to the users of the services, and how staff skills will be retained, and how service users view the future prospects. I haven't got that all written out, but I hope that the gist of it came across.
Thanks for that, Councillor Gilchrist. The only thing I would suggest is that's a fairly short time frame for that amount of information to be produced. I wonder if we should ask Evolutions to produce that for our meeting on the 9th of September.
If members feel it couldn't be achieved in time,
I'll
I'm happy.
put that to the meeting. Councillor McLaughlin.
Thanks, Chair. That does capture everything that I would want to see coming forward in the next report and the progress towards stabilising the budget and producing the kind of service that, to be honest, we expected to see some years ago when Wirral Evolutions was first established, because I don't think it varies that much from what was considered at that time in terms of getting people out into the community and more integrated. So I welcome that, and I agree with you that September is probably more reasonable in terms of bringing that information back. But I'd like to see in that time some of the more detailed work around what organisations in the community you've managed to make links with. I think what I'm trying to say is I would like to see the bones of the service or the more established elements of the service in place before you start talking about moving people around.
Right. Okay, thank you. Are you happy to change that motion? I'll just...
Thank you, Chair. I have to amend the date to take account of what members have said.
Thank you.
I haven't got the exact wording because I was scribbling it during the time, but I think our officers will have got it and the machinery will have recorded it.
Thank you, Chair. Same build as Councillor McLaughlin in terms of understanding the community groups. I think you mentioned that it would be, you talked about the kind of the arts or animals. It'd be really good to understand exactly which community groups you're targeting and then what their response is in terms of their willingness and their ability to partner with you, and the portion of your service users who that would cater to, but then for those who it wouldn't. I think we also had a suggestion, Chair, around an extended consultation, so not just with direct service users and their family members, but then also, you know, relevant members of the community who are considering it, etc. So, if the motion from Councillor Gilchrist can include an extension to the catchment of the consultation, I think that would capture it. Thanks, Chair.
How the community integration may work, the outcomes that we're working to, how is that going to lead to people being able to move on into training, employment, or entrepreneurship or anything else. So I'd want to see some of that and want to see something about some outcomes to that. So yes, certainly I think giving you more time until September may be better. can I just put that then to the vote in the committee? All those in favour? Can we take it by assent? Yes? See all those in favour? Unanimous? Thank you. Thank you very much. So we'll now move on. Mr Jones, the Unison Branch Secretary, wants to make a statement. Mr Jones, you have up to 3 minutes to address the committee.
Thanks very much, Chair and Committee, for this opportunity. It is a statement around Wirral Evolutions, the issue that's just been discussed. And we wanted to make this statement today because our understanding is that the organisation was due to make the decision on the restructure later this month in June. The paper and the discussion that you've had talks about a modernised service with promises of improved community integrated offer, more independent life skills, smaller ratios, greater personalised outcomes. But we do question whether these promises have substance. The ongoing consultation we've heard about, although that's brief for just 3 weeks with the parents and carers, etc., with talk of working with the letter that was quoted said we intend to work with people, parents, carers, to co-design the new support, but that will be after the decision has been made. In terms of the staffing restructure, there's been some talk about reduction in management costs, but actually the reality for us and for our members is we're seeing an acceleration of a two-tier workforce. As many as 41 out of 44 service coordinators and no less than 32 face pay cuts of over £2,500. That's 11% of their pay, with a reduction in the contracted hours on top of that. The proposals also see fewer operational staff in the service, with a reduction in the care and support hours of 10%, and that's if the organisation succeeds in reducing paperwork by 55%. The ratio of care workers has been told, we've been told, is to reduce from 1 to 15 to 1 to 6. But how is that going to be reduced if the amount of care workers and care hours is being reduced at that time? In terms of vocational services, which can be key to improving life skills and enhancing outcomes, and maybe even lead to a reduction of the need for day services for some people. Since Wirral Evolutions was first mooted, we've lost Star Design, we've lost Mass Theatre, and now one of the more substantial Best Bites training centres is to close and be replaced with a smaller, inadequate service at Oakenholt. Our members committee, who are operational managers and care workers, are dedicated and skilled. They've committed their working lives to Wirral Day Services. Why are they now rushing for the door? More than 70 out of 159 staff have applied for EVR. 84% of our members lack confidence in the vision that's proposed. 89% believe it should be brought back in-house. I attended a meeting personally with about 15 members to discuss the proposals. About half of it applied for EVR, and yet when the possibility of the company being brought back in-house was raised, they all wanted to stay with the organisation. The proposals that are being consulted on will see a cut of $240,000 in operational care staff costs, $150,000 from closing centres, and only $130,000 from the head office, and that will be offset by a £100,000 investment from another budget. Our members committee can be forgiven based on the information provided for thinking this is less about modernisation and more about pay cuts for care workers and cramming 6 centres worth of people into 4 centres. In February 2020, Scrutiny agreed to explore bringing the service back in-house. We believe that service could readily save £300,000 in costs, $56,000 on board costs alone. In January this year, you recommended a 6-month formal review. I would ask you at the earliest opportunity to give serious consideration to bringing the service back in-house before these poorly thought out, in our opinion, proposals are implemented. And we can then work together, staff, management, parents, carers, people who use the services, as well as counsellors and council officers, to design a service that truly promotes better outcomes for the people who use those services. Thank you very much.
Thank you. Thank you for that, Mr Jones. Committee will note your statement. Thank you. Right, we will now move on. Problem with not having paper is that it all disappears off your screen. We're now... on the commissioning. Yeah, sorry, Jane. Apologies. It had all gone back to a very pretty picture of mountains and lakes.
Thank you. Good evening, Councillor Nolan. Good evening, councillors. I'm here to update you tonight on commissioning activity for Q2 from the Adult Social Care Commissioning team. We're asking for authorisation for the Director of Care and Health to proceed with procurement activity within this financial quarter for the mobile night service, a beach accessible wheelchair service, early intervention and prevention services, a recommission of the Wirral Advocacy Hub and a pilot scheme for a scheme called Cardigan House. We're also asking for delegated authority to the Director of Care and Health to award the tender to the successful bidders following any tendering process. In terms of a brief description of the services to be procured, the mobile night service will be procured from our Wirral Care and Support at Home framework and is a domiciliary care service provided to people overnight between 10 at night and 8 o'clock in the morning, and that complements our daytime domiciliary care service. It means that we can run domiciliary care services 24 hours a day, 365 days a year, and that really helps us to maintain people in their own homes. We're currently exploring with a range of local partners and charitable organisations the delivery for a beach accessible wheelchair service, and we're hoping that we can, once we get delegated authority, get that running as quickly as we possibly can into the summer. We're also looking to recommission an early intervention and prevention service. This is currently with a community interest company which is made up of a range of local charities and partners and helps to provide services through contracted services for early intervention and prevention, supporting people through universal service offers and community support, helping to maintain people's health and well-being. The Wirral Advocacy Hub is a statutory service requirement for the council and includes advocacy for Mental Capacity Act, Mental Health Act and for Care Act support. We have all these services together, all delivered in one hub, and we're looking to recommission that service to meet new local need. Cardigan House is a former transformation of a former day centre in Birkenhead, and will be an award for a supported living service for a 2-year pilot that will look to deliver better and improved outcomes for people moving through services to become more independent. These decisions are key decisions given of the financial and cost implications, and we're hopeful that you will give us the recommendations that we've asked for this evening.
Thank you, Jane. So that's certainly an awful lot of commissioning decisions contained there in one paper. Just before I ask members to comment or otherwise on this report, I would like to say to people who are here for the Wirral Evolutions item specifically, please, if you wish to leave, that's absolutely fine. By all means, you're also very welcome to stay for the rest of the committee, but please feel free to leave. Nobody will wonder where you're off to, so please feel free to leave at whatever point you wish. Do we have questions on the commissioning paper for Jane? Councillor Walsh.
Thank you. I was just hoping if you could give a breakdown of the costs for the beach accessible wheelchairs, and if the wheelchairs will be an asset at the end of the 2 years.
Thank you. Yeah, those costs included an indication of costs from the other service areas that have been delivered in both Scotland and in Filed, I think, which is Blackpool. Filed, and that's the indication of what that costs. That includes a capital investment to purchase the actual wheelchairs that will remain an asset at the end of the pilot period.
Thank you.
Thanks, Chair. Thank you for the report. My question's also on the beach accessible wheelchairs. I think we've had an awful lot of conversation this past year about the real benefits of outdoors for mental health, and it'd be really good to understand the pilot scheme, and you mentioned a few other areas, but how have other areas made the most of this service, and what could this look like for us in the future after the 2 years is up? Thank you.
The team's done an awful lot of research on this. Several areas in Scotland run very successful beach accessible wheelchair schemes, as do some of the south coast towns and also Blackpool. Mostly run by local charitable organisations or volunteer organisations. And what we're aiming to do is to have either a similar offer on the Wirral or a blended offer working with local council services to do the same. That means that people will be able to access beaches via a range of specialist wheelchairs or machines that fit to people's own wheelchairs to enable them to access the beach safely. It also includes maintenance and check-in for safety purposes and storage, etc. For those vehicles. Thank you.
Councillor Mountney.
Chair, thank you. I have a couple of concerns, really. Director, you're asking for the best part, in addition of £10 million here, and in this report, I see no detail that I can show my residents that we're obtaining value for money. If you take the first one, for example, the only thing that this is telling me, the service provides a transport solution for staff. Now, without being flippant, that could range from a Rolls Royce to a pogo stick. And there's nothing in here. One of the other items is currently undergoing review. And I wonder, therefore, how I can justify to my residents that I'm obtaining value for money if I put my hand up for this.
Thank you, Councillor Mountney. I think that's a fair question, and in relation to the actual costs of these contracts, there's only the beach accessible wheelchairs, which is a new cost. All of the other revenue costs are already within the budget. The mobile night service is the service that looks after the most vulnerable people in our community that need support through the night. So it's a mobile domiciliary care service. I'm sure we can provide evidence in terms of how effective that is. When Wirral didn't have that mobile service, those people needed to go into residential care homes. So for each person, the cost would be about $35,000. But I'm sure Jane and the team will be able to provide evidence around that. The beach accessible wheelchairs, although it's sitting alongside the revenue cost of the other services, is of course a capital cost. So it's the investment in the equipment that's reflected there. And as a council, we can get hold of capital quite freely. In terms of the early intervention and prevention and carers, again, the evidence can be provided there in a lot more detail for committee members. And it may well be that the appropriate place would be our budget panel or something like that, where members are looking at how we're investing and how we're using resources to save, because actually early intervention and prevention is one of the key planks of our strategy to support people effectively in the local community, as opposed to them going into hospital and care homes and those sorts of things. Again, the advocacy hub and the final one, Cardigan House, I'm sure that Jane and the team can provide information about how we understand those to be cost effective.
Can I come back? If the information can be provided, would it harm this process if we put this off to the 29th of July?
Thank you, Councillor. In terms of some of the services that are due to be delivered there, they're already on our existing framework, so they're framework rates that have already been agreed by the council. So, and they'll be subject to the rates and fees increases that are in a later report this evening. Other services will be procured on a tendered basis, and that will be on a mix of both quality and value. So they'll be evaluated on that basis. Where we can, we commission either from an established Liverpool City Region framework or our own framework to do that. And we work closely with our procurement and legal colleagues to make sure that we are getting best value for money for the council.
I understand it's built into the process, but surely it's at the remit of this committee to authorise or not authorise.
I'm not sure the committee would expect that part-way through this stage of the municipal year, at the point of looking at contracts, we would be starting to review whether or not we want to commission the service. We would normally do that at budget time. There will be budget workshops as part of the budget process, where we will look at all the items that we commission that are in our budget and decide whether we wish to continue with them. But I take your point. Councillor McLaughlin.
Thanks again, Chair. To be fair, it's for any member of the committee to put a recommendation to committee and for the committee to take a decision on it. But when we had the spokesperson's workshop on budget the other day, which I'm sorry, I know you were working, I think, weren't you, Mary? Weren't able to get to. But we did discuss in detail how we would be looking at the efficiency of every service that we commission and that we provide ourselves. So that very detailed work is going to be going on every month between now and next May. I don't see a reason to change from the agreed format that we've used, but if Councillor Mountain wants to put it to a vote, we can do it that way.
Yes, Chair, if you don't mind, I would put it to the vote that I propose that this committee defers the decision until the 29th of July meeting.
So, thank you, Chair. So I am concerned that, you know, there's a significant amount of money, and as accountable officer, as accountable councillors, we need to be sure that what we're doing is the right thing. Therefore, we need more detail, and I'm just slightly concerned that there is very little detail in this document that's presented to us to agree to. Quite a large sum, considering the previous item that we've discussed, will have a huge impact on the services already present. So that said, I agree entirely with my honourable colleague in that, you know, we need to see more detail, you know, presented to the committee with some more background, and of course I'd second his proposal for a vote. Thank you.
Thank you. I don't think we've all been promoted to MPs yet, so I don't think we're all honourables.
Oh well.
Right.
It was a personal comment, Chair.
Yeah.
In which case, I will put that recommendation, that motion to the committee, that decision on this is deferred until the meeting on the 29th of July. Can I see all those in favour of that, please? Those against? Thank you. That falls. Right, do I have any other recommendations? Anybody moving the recommendation in the report?
I'll move the recommendations, Chair.
Thank you. Do I have a second for that? Councillor Cottier, thank you. All those in favour? Thank you. And those against? Abstentions? Thank you. Right, okay. Thank you very much. Thank you, Jane, for that. Yeah, got that. So we're on to infection control. It's the next item, which is the Director of Public Health. Julie, do you want to talk to that?
Thank you, Chair. I think we'd all agree that infection prevention and control has never had a greater spotlight on it than it has had over the past 15 months. We've invested one-off grant funding received from central government to develop the local service to respond to the pandemic. And we want to consolidate this investment and the learning from the past 14 months in the new contract. We need to go out to the market because that's we're at that time in the contract period when that's what the law tells us to do. Point 3.3 in the paper details our plans for the recommission to make sure we absolutely learn and build on our experiences. We're also proposing to put significant further investment into the community service because of our experience and the committee is requested to authorise me to recommission the Community Infection Prevention and Control Service up to the value of 2.45 million for an initial 5-year contract to begin next April, and to agree delegated authority to me to award the tender to the successful tender bidder. Thank you, Chair.
Thank you. Are there any questions for Julie? Councillor Camphor.
Thank you, Chair. I'd just like to ask Julie about the £2.4 million of infection control that's going to be provided over the next few years. As always, there's very little detail in this document for me to sort of understand the depth of what you're going to be offering. Could you enlighten me as to what this money is going to be spent on in the community? Thank you.
So, Councillor Camphor, the funding for this comes from the Public Health Ring Fence grant that the Council receives. In section 3.3 in the paper, we detail there that we're wanting a very visible, proactive service, which is very much about ensuring we've got good infection prevention control standards in all community settings. We're suggesting and we want to have a one-stop shop for all infection prevention and control requirements so that information is easily accessible. We also want the service to provide training and ongoing support into community settings, so that could well be general practice, definitely into community pharmacists, most definitely obviously into care homes. We're also obviously starting to develop our relationship with the new UK Health Security Agency, so we also need to be able to be in a place where we can make sure that that response is timely. And in all of this, obviously our focus has been on the pandemic, but you will be aware that we also obviously need to be very much aware and on the front foot with regard to other communicable diseases such as E. coli and C. diff. So I hope that gives you the assurance that you're looking for.
Thank you.
Sorry, Chair, can I ask a question? Thank you. Thank you very much, Julie. In the first portion, you talked about the potential for extensions. It doesn't include the potential for a break clause if you look to change the service. Is that deliberate, or I just wonder if that's a missed opportunity in case you need it?
No, we will.
Thanks, Julie. Thanks, Chair.
Councillor Gilchrist.
I think so far I'm drawing some lessons from this evening, if you'll help me, Chair. I think I first joined a social services committee, as it was, in 1977. So there are things that I've grown used to discussing over so many years that just feel like part of the furniture. And one of the issues that members always have, and especially new members, is getting a full picture of what does go on, what it costs, how it's organised, how the teams are organised, and how all the background services that make life palatable or keep ordinary diseases off our fingers, put it simply, all those things that go on in the background that help make us safe in the community. And the Infection Control Service is one of those, and those of us who sat in on meetings about COVID week by week since around about 15 months ago learned just how much work has to go on in ordinary nursing homes. In fact, when I visited nursing homes, I've found, banned because norovirus has broken out in a certain place, and we all understand the reasons for things like those precautions. So I think there probably is, based on the questions that have been put to us by some members, especially new members, an opportunity ought to be taken to give a sort of overview of things that go on and things that are done at a suitable time when it's convenient, so that perhaps basic things that old lags like me take for granted and just assume people know about are actually fully made aware to all new members, even if they're professionally occupied in certain aspects, I'm afraid.
Thank you, Councillor Gilchrist. It sounds like a good suggestion for a workshop session, maybe. I'm not sure what about old hands, but yes, I know what you mean. But yes, I think perhaps if we look at setting up a workshop session that new members may well find useful to get that kind of basic background information about things that happen continuously that are part of the background, part of the furniture almost, rather than the new exciting things that come in on top of that. Okay, thank you. Good idea. Okay, I'll come back to my questions. Anyone going to move the recommendations?
Well, happy to move it, Chair.
Thank you, Councillor Gilchrist, a seconder. Councillor McLaughlin, thank you.
Second it, yeah.
So you shout at me if I leave it on, so can't win. Right, that now takes us on to the discharge to assess bed-based service model. That's the director. Thank you.
Thank you, Chair, and good evening, members. I've taken my mask off for the first report. This report describes the proposed changes to discharge to assess bed-based services. The principle remains to discharge people home from hospital just as soon as they are ready for discharge and wherever this is possible. So the principle is very much home first. Some people, however, do need a period of recovery and rehabilitation before returning to their home, and this report therefore focuses on the bed-based services that offer this. The current arrangements for discharge to assess services are provided by independent care home providers across a number of different sites, 5 sites currently. There are 94 beds in total under the current contract, and there are additional services provided by the Grove Discharge Unit, which is a further 30 beds commissioned and contracted separately by the NHS. All services are on a fixed term contract, with contracts currently ending at the end of September this year. Providing effective multidisciplinary team support and case management for the people that use these services has proved quite difficult across the numerous sites of current service delivery, and it's believed it could be provided more effectively if services were brought together. It's also been a challenge to achieve average lengths of stay for people that use these services that mean they're only in services for as long as they need to be and that they get home just as soon as they're able to. So this report seeks support from members to progress with a single site offer operated by the NHS, potentially at the Clatterbridge site where there are units available. The proposed service would have a lower number of beds, proposal is 71, but being provided by the NHS with wraparound support and reduction in length of stay would give people a greater opportunity to return to their homes as independently as they're able to. Members of the Adult Social Care and Public Health Committee are therefore requested to support the proposal to end the current D2A independent care home contracts, which are due to expire at the end of September, to support the progression of proposals for a D2A bed-based service to be commissioned by the NHS and provided on a single site basis, and also to support the proposal for an additional 30 beds as described in the paper, which would be community care sector beds for a transition period of up to 6 months, and for further information about the reconfigured services to be presented back to committee members. Thank you, Chair. I understand you will have read the report, and I'm happy to respond to any questions or comments.
Thank you, Jason. Any questions for Jason? Councillor McLaughlin.
Thanks, Chair, and I'll give you them all in one go, if that's all right, Jason. First of all, in point 1, in 1.2, you say that data shows that a single site will reduce the length of stay. Could you give me some idea as to what the data is that actually shows that, without just having a single site at the present time? Also in 3.1, you talk about Summerfield, which is the EMI provision, being part of that one site. And I'm wondering about the suitability of that as a very specialised service, EMI, being on the one site, and would that very high level of specialty be available there? Also, in 3.2, you talk about the involvement of Four Seasons, and I think some of us have concerns over some of the services provided by that organisation locally, and also its financial position. And you say that period of contract is going to be extended. Can you tell me what the involvement of Four Seasons will be ongoing after that in this NHS run unit? And finally, you give a figure for, in 3.13, you give a figure for what the assessed need for beds will be. Can you give me more detail about how that figure was arrived at? Thanks. I hope that's not too many for you all at once. Yes.
You got a good run for your money there, Councillor McLaughlin. Got a good run for your money there, didn't you?
Thank you, Councillor McLaughlin. So I'll do my best to remember this and refer to my notes. So the first question was about evidence for the length of stay, average length of stay. So during the COVID pandemic response, we've had an NHS provider operating a D2A type service on a temporary basis to increase capacity due to increased demand for COVID and to support the hospital discharge process. That service is known as Bluebell Unit, and it's a 22-bed unit, and it has evidenced at the time of the report about a 22 to 23 day average length of stay with some fluctuation. So that's the supporting the theory that the NHS providing the service and linking in to all of the community health and social care services that are already arranged in Wirral can be more effective. The second one around EMI specialty care. We do recognise there is a need for EMI care home capacity for people to be discharged from hospital. We would expect a single site NHS service offer to support the needs for people associated with dementia in general, but where people are have very severe symptoms of their dementia, it may not be appropriate. So we are looking at a transition arrangement for some additional care home beds, and we always have the facility to contract with the care home sector and to flex up and down where we have particular needs or particular capacity pressure points. And of course we've demonstrated that throughout the last 12 months where we've commissioned extra services for short periods of time. The care home sector generally, as we'll see in the performance report later on, has got something like 18-19% vacancies at the moment, so there is still capacity in the system should we need to look at that separately. In relation to the third question around Four Seasons, this is the Grove Discharge Unit where tomorrow's Four Seasons currently provide the care. That service has been extended whilst there's consideration for the proposed new single site offer. It's not proposed in the suggested service offer that it would be an independent sector care provider that would provide the care on the unit. It's proposed that the NHS would provide NHS staff to support people and to link them into their ongoing care arrangements. So that's subject to final decisions around this proposal. It wouldn't be expected that Four Seasons or another care provider would be providing the service on the single site. And then, forgive me, question 4. Yeah, bed capacity. So at the moment, we've got the 94 beds commissioned as part of the D2A general contract. Additional 30 beds at Grove Discharge Unit, again time limited, and then we've had the Bluebell Unit temporarily. So in Wirral we've got above the national average for intermediate care bed-based services. Our analysis of the data suggests that when some bed modelling was done on nursing care D2A beds in February 2020, that led to the figure of 26 per 100k, which is above the national average of 23 per 100k. If you include the Grove Discharge unit beds with that, it brings it up to mid-30s, late 30s, 35, 37, something like that per 100,000, well above. So we know that in Wirral we've got above national average for intermediate care bed-based services, and many other areas provide more support to people in their own homes and rely less on bed-based services, which is where we want to get to, and that principle of home first really stands. The proposed 71 beds are really based on the potential opportunities that we have in Wirral for an NHS site. So the 3 units or wards that may be available for this site would be able to offer that number 71 beds if this proposal goes through.
Thank you. I just wanted to ask a couple of questions. One is around the 26 beds as we are today, so at 26 per 100,000. Of the 124 beds we have today across multiple sites, that takes us to 26, or maybe it's more as you've just stated, and the national average is 23. What will be our position when we are at 71 beds in April 2022? And given the population of the Wirral, perhaps we should be over the national average anyway because of the population that we do have. But will we be drastically underserved and underprepared if we only have 71 beds?
Thank you, Councillor Walsh, for the question. So if we had the national average, I've got this the other way around. If we had the national average of 23 per 100,000 population, that would be 76 beds. So 71 would obviously be a bit below that. We have got ambitions to really rely less on bed-based services and get that average length of stay as short as we can to get as many people home as quickly as we can. So, as I say, 23 average per 100k would be 76 beds, and we're proposing 71. But it is important to say that we are also proposing an additional 30 beds, at least over the winter period, for up to 6 months, and to keep that under review and see if we really can rely on 71 beds as the core commission, or whether we would need more. So that would take the average well over the 23 per 100k national average for that period of time. So I think we are quite responsive as commissioners. So we do have very good monitoring of the triggers, the tolerances, the demands through the health and care system, and we have daily conversations and weekly conversations around whether our commissioning is right, whether we need to change, and we do try to respond quite quickly. So I don't think, even if we went for a 71 base core model, I don't think that would be the concrete end of, no further discussion about anything additional. And during the transitional period, if it proved that we had increased demand because the ageing population of Wirral is facing a very hard winter, for example, or there are other infection control issues that create higher demand, then I'm sure as a system we would be able to respond to that, to flex.
Thank you.
Thank you, Chair. I've got a couple of questions, Jason. Firstly, which site at Clatterbridge are we talking about? Because everybody gets confused. I take it we're not including Bluebell in this. We're looking at Worth.
If I can get myself off mute. We are looking at the current Bluebell ward site as a potential site, and there are another 2 wards, I understand, on the Clatterbridge site. The names that I have for them, I'm not sure if they are there.
So you're looking at what was Conway, Mersey and Delamere?
I believe those are the ones, but I have to say, Councillor Jordan, that I'm not familiar with the site myself, so I can perhaps get back to you to confirm what the current names of the wards are.
That's fine. My question's around item 3.7. Again, it's about the numbers. The 26 compared with the 23 per 100k. I would have thought that in Wirral we have a much greater ageing population than the national average to start off with. I mean, if you take the numbers of people living with dementia in Wirral, it comes to about 4,500 compared with just over 5,000 in Liverpool. And you compare GP practices between the two, it's 53 versus 93. So it's fairly obvious that we've got an ageing population with quite complex needs in Wirral, and I would have thought the need was there for more than the national average number of beds. And my concern is that if we cut to these 71 beds, we'll leave people without provision.
Thank you, Councillor Jordan. The modelling and the work done by commissioning colleagues and NHS colleagues looking at this does suggest that if the average length of stay was brought down to between 3 to 4 weeks, there would actually be as much, if not more, capacity for the numbers of people that require the service. One of the challenges has been with the current services. We have a target of 4.2 weeks for the average length of stay, and it's very seldom been met by the current arrangements. So by having a shorter length of stay with fewer beds, we can actually meet as many people's needs as long as we keep the throughput.
Chair, thank you. Is that 71 number site restrained? Can you increase that number on those locations by the odd 2 or 3 at once, or would it mean opening up another location?
So thank you, Councillor Mountney. My understanding is that they are constrained by the site. So there are 3 wards. I believe they're the wards that Councillor Jordan named, and I believe those are the numbers that could be safely supported. There would be, as I understand it, there would be the scope and potential to focus on cohorted areas within those units or wards should there need to be for infection control purposes. So it is possible to reconfigure within those wards, but my understanding is that we couldn't increase the numbers on those wards or units to provide safe and effective care.
Just a brief element. I think that one of the key questions that elected members are happening is how are you confident? Why is it you can be confident that this service can deliver with less beds than the service you've currently got? The service we've currently got is directly through care homes, standard sort of care homes. I think it's fair to say that the staff aren't necessarily specifically trained in rehabilitation techniques, and of course the therapists need to travel around a number of sites to get in and out of the service. So the therapy input tends to not be as good as it could be. The notion here and what's been tested at Bluebell is that what we've got is a highly trained bunch of NHS staff with rehabilitation training absolutely at the core of what they do. I went around talking to all of the staff just a few weeks ago to find out why it was that they were managing to get people through at a much more kind of rapid level. And what I found was it was very simple. They were getting more therapy. They were being getting a lot of attention, and they were moving around a lot. In what is actually a very good site, the accommodation is excellent, and that's really what is making the difference. It's the quality and the training of the staff on the site. And I think it is hard, without actually seeing it, it is hard to conceptualise, well, why will this be better than what you've got at the moment? Thank you. Thank you, Chair.
Yeah, based on what's been said, Chair, whilst there is a recommendation, well, obviously some members are uneasy about what I'm going to call a transition. And obviously officers would know how things are going. I wondered if I might suggest an amendment in addition to the resolution, which would be on these lines, that in the event of stresses and strains arising in the proposed arrangements, officers be requested to report back to members and advise them on the steps being taken. Could I move that as an addition? Yes, an addition, yes, thank you.
I'll second that, Chair.
If there are stresses and strains within the system, a report will come back to this committee. On that basis, can we support the recommendations? Have a proposal to that effect, please. Phil, thank you. Seconded by Councillor Jordan, thank you. Is that all agreed? Agreed. Thank you very much. Right, we are on fee setting is our next item. Our joyful annual event. Jane.
Good evening again, councillors. This report will update on the outcome of our annual provider fee setting engagement exercise, and we're asking for approval of the rates as set out in the table at 4.1 of the report. The rates and fees included in the report relate to residential and nursing services, supported living, extra care, care and support at home, and direct payments. We're also requesting that we approve backdating of the rates to apply from the 1st of April 2021. We do undertake an annual exercise. We have a statutory duty under the Care Act to maintain a vibrant market. And as part of the exercise, what we always aim to do is share our fee models with providers and make sure that we've taken into account costs and other factors that care providers tell us about that they need to be considered. We always aim to meet the challenge and demonstrate that the approach we've adopted in relation to our engagement exercise is open, fair and transparent. We aim to set a rate and fee that stimulates a responsive and flexible market, make sure we can meet our statutory duty of maintaining capacity, and make sure that we've got a sufficient range of provision to meet local demands. The consultations undertaken are on behalf of both the Council and Wirral Health and Care Commissioning, including Wirral CCG. In COVID last year, as part of our COVID response, we incentivised providers for a period between the 1st of May 2020 and 31st of March by aiming to pay the real living wage for frontline staff of £9.30 for last financial year. Included in our recommendations coming forward this year is a total cost of £8.9 million to meet that for the sector for next financial year, and that will be to meet real living wage of £9.50 for this financial year for staff. Throughout the year, we've seen an increased take-up from providers in relation to the real living wage, and that's a position that continues to improve as time goes on. As part of our fees, we've also taken into consideration the recent High Court appeal judgment in relation to the MENCAP case, and following that case, the council took a decision and the recommendation not to go back to paying old sleeping rates, but to continue to remunerate staff with rates and fees that as a minimum cover the national minimum wage for overnight services. The total cost implications for the year, £8.9 million, and also include costs for reablement and also for the mobile night service going forward. I understand that members will have read the report and I'm happy to take any questions.
Thank you. Thank you, Jane. Are there any questions for Jane on that report on fee setting? No. Oh, yes, Councillor Mountney.
Just very briefly, what was the pressure on the same report last year, please?
I think £3.1 million for last financial year. This real living wage this year takes it to 8.9.
Any further questions, comments? Do we have a move for the recommendations in that case?
So moved, Chair.
Thank you, Councillor Fox. Have a seconder? Councillor Cottier, thank you. All those in favour of accepting the recommendations, please show. Thank you. That would appear to be unanimous. Thank you very much, members. You really all have read the reports, haven't you? Right. Very comprehensive reports as well. Thank you very much for that, Jane. It must have taken an awful lot of work. I know it took an awful lot of reading. It must have taken an awful lot of work. Right. Agenda item 10, back to you, Director of Public Health, on the National Drug Treatment and Recovery Grant funding.
Thank you, Chair. Councillors will be well aware that unfortunately in Wirral we have deep-seated problems related to illegal drug misuse and then the consequent health problems that individuals then experience. In January this year, the government announced an additional £148 million funding package to reduce drug-related crime and health harm. We've been awarded £1.4 million as part of that programme that has to be spent during this current financial year. This is challenging, but we have a history of a strong partnership working that we believe will enable us to deliver, or certainly work towards delivering the outcomes connected to the grant allocation. The paper outlines the partners involved. You'll see that they are many, including the local police force, the justice system, children and young people's team, housing, employment, and our specialist drug treatment service. So it's a whole system response, and one that we're familiar with and that we've worked with for a long time. People will remember the DAT, the Drug and Alcohol Action Team, and maybe for some of us who have been around a little while, we might consider that this is actually the reintroduction of the DAT. We actually maintain the DAT, not in its name, but certainly in its working practices since 2012-13, when DATs were actually abolished. So I think we've got a good grounding, we've got a good structure, we've got a good partnership arrangements to help us move this work forward. We were given a defined list of interventions to fund, and the exempt appendices detail the interventions and our proposed spending profile. So we're bringing this report to you today to give you that overview of the funding, outline the proposals to use the funding to ensure that we achieve the three main objectives, which are around reducing drug-related deaths, drug-related offending, and the prevalence of drug use. Really big outcomes, but ones that we need to work on and we have been working on. So the committee is requested to note the contents of the report and agree to accept the grant funding and agree the proposals for spending the 1.4 million grant funding. Thank you.
Thank you very much. Can I ask, first of all, if any members wish to discuss any items that are in Appendix 1 or Appendix 2? No. Right, thank you. In that case, because otherwise we would have had to have moved that to the end of the agenda when the public have been excluded from the meeting. Anyone got any questions on the main body of the report? Thank you. Apart from mine, which is, good Lord, how do you do anything with a steering group that size? Which was my question. Councillor Frost, then Councillor Cannon.
Thanks, Chair, and thanks, Julie. My question was just in relation to point 8.1, with the huge number of partners that are all detailed, which are part of the steering group. I'm just keen, question for understanding more than anything, I don't see any representation of schools or young people's education, so interested in understanding in terms of kind of the early start on more from a preventative side, where schools and the representation for young people's education would fall in that scheme. Thanks, Julie.
We are working closely with the Children and Young People's team locally, so obviously we'll pick up that early intervention prevention work through them. I think your point about schools is well made, and I will take that point back. I also take Councillor Nolan's point that this group is enormous. So that is the steering group, but underneath that there is a smaller management group that is there to make sure that the funding's allocated and spent, and that we're achieving the targets that have been set for us. Thank you.
Any other questions or comments for Julie? No. Okay, in that case, do we...
So moved, Chair.
Integrated Care Systems, the Director.
Thank you, Chair. Thank you, Chair. Thank you, Committee. This is a paper for noting, so I will keep this brief. Since this committee last received a paper in relation to the forthcoming Health and Social Care Bill, we've had the Queen's speech. So the paper sets out some of the key links to the Queen's speech in terms of those changes. The changes will put the borough or place at the top of the strategic planning of outcomes for our population, working alongside NHS colleagues, both at a local level, a very local level through primary care networks, but also a Cheshire and Merseyside level in terms of the new integrated care system. The key for us in Wirral is to ensure that that is linked very closely with the Wirral plan, which clearly are the outcomes that as a council we are hoping to achieve for our population. Just within the paper, the various roles are set out because there are a number of acronyms in this. So you've got Integrated Care System, which is the Cheshire and Merseyside partnership level. There's the Integrated Care Partnership, which is how we work together in Wirral, and that has three key elements. It has the Health and Wellbeing Board as the senior partnership, or the Place Board, and then it has the Integrated Commissioner and the Integrated Care Partnership. The Provider Collaborative. Within the paper also there's time frame and next steps. Until the legislation comes out fully, this is quite general as a paper that sets out the general conditions, but we will see some significant changes, including the dissolution of the CCGs locally, which is the primary change here, and the responsibility for that commissioning transferring to the integrated care system. And of course, from our perspective, it's how then we work with the integrated care system to keep the focus on the population of Wirral. Thank you, Chair.
Thank you, Graham. Any questions or comments for Graham? Councillor Camphor.
Thank you, Chair. So the integrated care system is a significant move on the part of the government to reform the current NHS, and has significant opportunities and has potentially quite exciting things happening. The ICS in Cheshire and Merseyside is being developed and evolved, and as we wait for specific guidance, that will happen. I'm more interested in place and in Wirral, and how you are developing the integrated care partnership here, and what aspects of that have been crucial, in particular to the PCNs and place and the so-called neighbourhoods. So to understand the difference between neighbourhoods and PCN, I think, is important, but also the integration of the voluntary sector into this partnership, which is going to be local. So I would like to point you in the direction of St Helens, where they have an integrated model and have had it for the last 2 years, and I've been fortunate enough to see that. And I just wondered where Wirral was, given that we only have a short period of time before the 1st of April next year, and what progress you'd made in this time. Thank you.
Thank you, Councillor Camphor. And as you say, St Helens has that integrated model, and much of what we're looking to develop is very similar to that type of shared model. We are at this stage focused on those key principles around the triumvirate of the Health and Wellbeing Board, the Provider Collaborative, and of the Integrated Commissioner. But and I guess a lot of our focus has been on the role of the Integrated Commissioner and the relationship with the Health and Wellbeing Board as the place board. But absolutely the case is that primary care networks will be central to the delivery at a localised level, and our understanding of what neighbourhood needs are at a very local level is going to be key to that. We have developed a comprehensive suite of data at that level through colleagues in public health, and we are able to now analyse and show what those needs are. And I think that the key to that really is the linkage with primary care networks and the focus on social prescribing at a very localised level, because we have had some very positive results, particularly in relation to high users of NHS services, particularly primary care, and quite low-level inputs from the voluntary sector to support that. And there's some very good evidence that's emerged around that. So there isn't a lot of detail in this report, and that's because it is still developing, and there's a lot more work to take through the Health and Wellbeing Board, and a lot more conversations with our provider colleagues around how this will specifically work. But everything that you've said, Councillor, is part of the thinking at the moment. Thank you.
Okay. I'd be quite interested in hearing your views on the difference between a PCN and place and its impact on the partnership board locally. Thank you.
Okay, so neighbourhoods are the places where people live, and nationally the focus has been on a 30 to 50,000 population. We did have a picture, if you like, or a geographical map of neighbourhoods in the borough. Now, the formation of the primary care networks could have taken place on that basis, but relationships were such that the working relationships between different practices may not have worked on that geographical basis. So primary care networks have evolved associated with those neighbourhoods, but the practices are gathered more around collaboratives that feel they can work together rather than necessarily starting where people live. So there is a difference between a primary care network and the neighbourhood. Can the two things work together? I'm sure they can. We just need to work out how that can happen. Thank you, Councillor.
Any other questions on this? Councillor Gilchrist.
This is a comment, and I probably be best emailing a link to the document to members to enjoy in their spare time. But the House of Commons Select Committee, chaired by David Hunt, produced a report which is 50-odd pages on the in mid-May, and I've been working my way through that, and they have a large number of conclusions. But the one of the sections says it is vital that local populations have confidence in the boards of the NHS body and the Health and Care Partnership, and transparency in the appointment processes for these boards will be a key factor in that. I think for long-standing members, Chair, what happens at place, what I call what goes up and one comes down, is of as much concern to members about what we actually get in our place and what happens in levels circling above us. If you get the picture of the Merseyside Cheshire thing happening above us, but us wanting to know if there are any implications that might land on us from the work that's going on up there. I hope I explained that fairly, Chair, but there are obviously signs that members are like the idea of place, but also have some interest in what's going on in the stratosphere above the place. Thank you.
Any other comments or questions for Councillor Camphor?
Thank you, Chair. So perhaps I can enlighten my friend here that the ICS is a board that sits across Cheshire and Merseyside and will actually be involved not only just in commissioning of services that will be across the patch, but also directing the ICP, which will be sitting in place regarding what is provided. In general practice, we've been very concerned about the change and its impact on service provision in various places. So, for example, here, as compared to St Helens or Warrington, or for that matter, Liverpool. So, GPs are concerned about it, but they are working very closely with the local medical committees and the ICP to ensure that services are provided in an equitable, fair and transparent manner. And some of the monies for the local commissioned services will actually come through the local authority and the partnership board. So that is something that, you know, we need to be careful and aware of. Thank you.
Yes, thank you, Councillor Camphor. I think that is something that we're conscious of, and our programme teams who are currently working up what Wirral as a place will look like and how it will work, alongside our provider colleagues who are working on there, how the collaborative will work, are very aware of how services will be commissioned. Currently, we're being told from the Cheshire and Merseyside board that they envisage only around 20% of commissioning being done centrally by themselves across the region, and the remainder being will be diverted down to local places. And so we would hope that integrated care partnerships will actually be able to commission somewhere in the region of 80% of the budget. Obviously that remains to be seen. Detail needs to appear, and all of that, as ever at these points and these things, is dependent on the guidance. So nothing is certain yet, but it's interesting from the director to hear how progress is being made. So there will be much more to come on this one, I assume. Thank you very much. No further questions on that one. What's our recommendation, Graham? Just to note it. Are you asking us to note it, Graham? Yeah. So this is, recommendation is to note this report. Is that agreed? Agreed. Mover and seconder for that, please. Councillor Walsh?
Happy to second.
You'll second it. Did somebody move it? Oh, I'll move it, for goodness sake. Right, thank you. Thank you very much. That takes us then on to the appointment of the Statutory Committee and the Member Champion for Domestic Abuse. That's down to you, Vicky.
Thank you, Chair. Members, this report explains that under the Mental Health Act, an individual who's subject to guardianship can request that the local social services authority discharge the guardianship order, and this function must be exercised by 3 or more members. Therefore, this report is asking members basically to establish a discharge from guardianship panel and to authorise the monitoring officer to carry out the wishes of the group leaders in appointing members to that panel. The second recommendation is asking members to appoint a member champion for domestic abuse. Members will no doubt recall we did have a number of member champions associated with the Wirral Plan pledges. They were brought to an end in 2019, but under our new constitution, which we adopted when we moved into the committee system last year, champions for 3 specific areas were retained. One of them was a champion for domestic abuse, and that falls within the remit of this committee to appoint that member.
Thank you. Yes, can I just say, as a member of the discharge panel, I don't think we ever met last year. No, exactly. In many, many years we've never met. I don't know if the Conservative group want to keep their present member, or did you want to put somebody who's actually on this committee? Mary, did you want to change that?
I think it would probably be best to have someone on this committee.
Yeah. Is that you?
I'm happy to be on it.
Okay, thank you. As I say, it never has met. Having said that, you watch, now it'll meet. Tempting fate. So, with the change from Councillor Burgess-Joyce to Councillor Jordan, and then the appointment of the domestic abuse champion that is currently me, which I'm happy to continue with. Councillor Cannon?
Sorry, it was just simply to recommend you, Chair, to continue in the role for domestic champion. Thank you.
Sorry, any other nominations?
Happy to second that.
Thank you. Any other nominations? No? Right, thank you. Thank you all very much. I'm very happy to continue in that role. Thank you.
So I've taken this because on behalf of the Director of Resources, really just to ensure we limit the number of people that we have available in the committee room, and it made sense to do it that way. So this paper links, first of all, to the financial support that the Council has needed to access from the Ministry of Housing, Communities and Local Government of £10.7 million. Really sets out how important that is in relation to both this year's budget and the robust arrangements and reporting framework for 21-22, but also the budget setting process for 2022 to 23, and of course the important role of this committee in monitoring our progress in delivering against the budget. There are a number of appendices that are important documents in this paper, and that does include the savings initiatives that are in place for this financial year. I know the committee is, absolutely committed to having close oversight through monitoring the budget and through its budget monitoring group this year, and of course, committee will also. The Budget Monitoring Group will also receive detailed demand and activity information through the year, which is exactly the same as I receive as Director of the service to understand what's going on. The committee is asked to note the content of the report, to agree to developing proposals for 22-23, and in order to do that, to organise budget workshops regarding next year's budget, and also to commence a zero-based budgeting exercise. Thank you, Chair.
Comments or questions on that report? Councillor Cannon.
Thank you, and thank you for that, Graham. I think it was just around the zero-based budgeting, which is something that we were quite excited about last year. I think it was just, I know it's a really small amount of savings so far, but I think it was just to get an idea of how you feel that's going to go forward, and do you think it's going to be as effective as we hope it is? Thank you.
Well, the good news is in adult social care, we undertook a zero-based budgeting exercise last year. And what happened is we had an expert that came through and went through all of the budget lines and, in essence, deleted old budget lines that were no longer required, went through the reserves and all the various elements of the budget, so that what we've got this year is a budget which is based on that zero-based budgeting exercise. So in terms of the detailed work of cleaning up the budget, which I think is the thing that takes a lot of time, that's already been done. But obviously, that's not the same as you move into a zero-based budget for each financial year. So what I can tell committee is that baseline work has been done. It delivered a small amount of savings last year, but the key thing here is having a budget which accurately reflects the spend. So we had, for a number of years, we were offsetting spend against care services, those that were going direct to people, from some of our staffing budget, and both of those lines were corrected, for example, during the zero-based budgeting exercise, to reflect the reality rather than the historic budget position.
Any other questions, comments? Councillor Gilchrist.
Thank you, Chair. I don't think anyone underestimates the amount of work that has to be done to try and help us live within our budget when there are so many pressures, and we have to respond to the proper proposals of the Care Act, which we have to make sure people are assessed and offer services to and provide them. Just a query, and it really does crop up when we get to item 15, but I'll raise it now. One of the processes that involves our partners, especially in the community trusts, Community Foundation Trust, is undertaking these detailed reviews of people receiving services to see if what they're getting is right, or to be enhanced, or whether they've improved so much that they now don't need as much service. And in the past, I've raised the issue about aids and adaptations as getting them right to make sure that people get what's needed at home, and that will help. But in the tables that we have later on, there was great difficulty shown in the ease with which reviews can be completed, because we've been through this COVID period. Obviously, it's not easy to assess people's needs in their homes. So my anxiety is that we have these targets for partners that might be difficult to fulfill if things, shall we say, don't continue to improve. And my hope is that things will improve, as all of our hopes is, but it's a risk that I'm just flagging up in case things can't be done in the way that we'd like.
Yes, I think it's fair to say that face-to-face review has been challenged, and certainly the Trust found that undertaking that level of review activity that's expected over the last 12 months was very difficult to manage. I think they are finding new ways, and we're certainly finding that we can still make arrangements to meet with people and to review them in safe terms, and that's kind of been developing over time. And obviously there has been some progress in relation to the vaccinations and the status of a lot of our older and vulnerable people in relation to that. So we are expecting that there will be improvements in the number of reviews, but nevertheless, you know, we don't know exactly what's going to happen with COVID-19 going forwards, and we'll always be in a position of needing to react if the situation changes significantly. I think that there is activity data here as well for you, and what you can see in the activity data is some of the key shifts. So you can see a big shift in terms of extra care services becoming available for people, even through this COVID period, we've still been able to continue with the development of those sorts of services. Assistive technologies services can go into people's own homes. And of course, we've seen no break in the community equipment service contract. That's going out same-day delivery for people that need equipment and all of those sorts of things. So changes can be made very quickly, but I do agree that changes to people's care packages, but I do agree that the face-to-face visiting side has been challenged somewhat during the COVID crisis.
Any further questions on this budget? This budget will run and run, so but thank you very much for that report. Obviously, we will get the budget workshops set up and underway. We'll sure work out a set of dates for those. Do we have any idea when we're going to start those?
The idea is that any proposals in relation to the 2022 budget go to... I think he's just reminding me. The idea is that any proposals for the 2022 budget go to P&R committee, and I can't remember exactly whether it's September or October. It is in the report here. So clearly we're looking at September. We need to be considering the budget. We do have a very high commitment in the medium-term financial plan already, so that what we do is carry forward those several million of proposals in terms of reviews. And so, you know, in terms of the amount of, I suppose, savings that are presented going forwards, then they are quite high for this committee. But nevertheless, the committee needs to consider whether there are other things that should be in there as well, and whether those savings, as they are achievable. And some of that comes through the annual monitoring of the budget and understanding what's happening in terms of capacity and demand as well. So September.
September. Thank you. So can look forward to budget workshops in September, members. Thank you. Are you asking us to just simply note that report? Have a mover and seconder for that, please. Thank you, Councillor Gilchrist. And Councillor Jordan, thank you. Mark, can you take us through the capital and revenue budget monitoring? Thank you. You've sat patiently waiting for this moment.
Thank you, Councillor. Just find the relevance place. So this report is the outturn report for 2020-21. So you've received quarterly reports throughout the year on this, and this report's the final position of the year. So we reported a 1.1 favourable position for the year against budget for the reasons that were spelled out in section 3 there. So we were reporting mainly balanced throughout the year, but we came to light near the end that there was 2 invoices that needed adjusting, so that only came to light right at the end. So that improved our figures significantly. But the main reason for the favourable position is the extra funding that we've received for COVID throughout the year, particularly from the government and the CCG. Without that additional resource, the pressure would have been significantly adverse. So the details of all the variances are detailed in the report. So I'll leave it there if that's okay.
Again, working on the basis that members have read this report. Any questions or comments for Mark? Councillor Gilchrist.
Just to flag up that in section 3.20 there's a reference about the programme of assistive technology installations and extra care schemes. So I'm hoping that when we're monitoring the budget through the year, we can keep asking about progress with those, because they are key to our, I'm going to say survival, but key to our living within our budgets and serving people at the same time.
Couldn't agree more, Councillor Gilchrist. Any other questions, comments? It must feel like it's a very quick process for all the work that's gone into it. I assure you that's not the be-all and end-all. Members will have read this report, so please don't think that we've just skimmed through it without taking account of it, because we have read it and we do appreciate the amount of work that goes into these reports. Thank you.
Thank you, Chair. So this is the Adult Social Care Performance Pack that members will be familiar with. So Adult Social Care and Public Health Committee members are recommended to note the content of the report and to highlight any areas within the report that require further clarification or action. The body of the report is attached at Appendix 1. I don't propose to go through in huge detail, but I would like to just draw some areas to members' notice, if that's okay. So the first one is residential and nursing care home residents. As has been mentioned earlier in the meeting, Wirral has a high level of older population, and the number of residents in care homes as at April 21 was 1,494, and that's lower than the 1,525 in the previous May. So that's going against the trend of the demographics. Also, I'd like to draw members' notice to the level of vacancies in the care home sector. This information is slightly out of date by the time the report comes to this committee, but of the 3,562 total care home beds registered in Wirral, at the time of the report it was 18.9% vacant. So we do have capacity within the system should we need it. On page 10 of the performance report appendix, there are 19 care homes showing as closed to admissions, but I wanted to assure members of this committee that as of today there are no care homes closed to admissions due to COVID and for infection control reasons related to COVID, which is very different than has been in previous months. On page 13 of the appendix, there's some information that members previously requested around Care Quality Commission notifiable incidents. This area of the report we've included, but I would stress it's under development, so some of the data within the report needs to develop as we get the reporting mechanisms in place for that, but that was helpful for members to highlight the need for that inclusion. And then finally, I would just like to mention the reablement outcomes, which again, members shaped how we present this area of the report. Previously, we had a long list in a table of different outcomes, and it didn't present in a very meaningful way to members. So now we've condensed that down, and the main reason for reablement services ending are that people have achieved their aims with no ongoing services. So that's at page 28 of the pack. I'm sure members will have read the report and may have some questions and comments, which I'm happy to respond to as best I can.
Thank you very much, Jason. Yeah, I mean, I certainly read that that report, particularly the comment on reablement. table on reablement, that's really, really satisfactory. That we can see that people are moving out of reablement with no requirement for ongoing services. That's excellent. Any comments, questions? Councillor McLaughlin.
Thanks, Chair. To comment as much as anything, Jason, because the other day when we had the spokesperson's budget group, I raised again the correlation between increasing numbers of extra care provision beds and the number of people in long-term residential care. And again, said, as I often do, that figure isn't really balancing in the way that you would hope. And you were able to tell me in no uncertain terms that that wasn't correct. So I think that's probably worth repeating to the rest of the committee that there has been a significant reduction in the demand for long-term residential care because of the extra care housing. So in fairness to you, Jason, I think you should tell everybody what you told me the other day.
Thanks, Councillor McLaughlin. Yes, so the demographics are going one way, aren't they, with the population of older people significantly growing in Wirral, and the number of new care home placements has reduced year on year, and the total number of people within care homes is less. At the same time, we've seen the extra care numbers increasing with our programme of investment and development of extra care housing, and this year we have Poppy Fields development at the Sohol Massey site, which I think is 78 units, which will be open for people to move in later in this year. So we are seeing the direction of travel going in the way that we hoped it would, with the majority of people being supported in their own homes.
Yeah, that's very satisfactory to see. That really is. Councillor Cottier.
Thank you, Chair, and thank you, Jason, for that data. Could I just be really, again, pedantic and ask for pre-COVID data, just so we got more of a comparison, if that's possible?
We certainly do collect the data on an ongoing basis, so I'd be happy if there are any specific areas that you're interested in, we can certainly have a look.
Just the notifiable incidents stuff. Lovely.
Okay, so the notifiable incidents is an area that hasn't, up until members requested it, has been built into our usual reporting arrangements. Much of our reporting from this pack is derived from our case management system and our payment systems and our case management systems. So we are still looking at the best way to collect that data. The best we can do at this point in time is to request that data directly from the Care Quality Commission. So we can do that, but I would put a caveat around our current data for notifiable incidents. I think it's the first time it's appeared in this report. The numbers don't look quite right to me because they're too low for safeguarding and deaths, for example, which just doesn't look quite right. So we need to get the reporting right, but we can certainly make inquiries to the Care Quality Commission on behalf of members, so I'll take that as an action from tonight.
Thanks, Chair. And Jason, thank you very much for the inclusion of the alerts portion. I appreciate that it's new data, so my questions might more just be builds. I think within it, it'd be really useful to have national averages or Liverpool City Region averages so that we can get a handle on it. I was going to ask around the level of the numbers, but you've already flagged your question mark over them. On page 15 of the report, you've got number of alerts by outcome and then number of alerts by sub-theme. It'd be good to understand in terms of this data, because it's the first time we've seen it, can we marry these things across? So does the 6 for ongoing account to the 6 for abuse or alleged abuse, things like that? So help us understand the data a little bit. And then regardless of the number, in terms of your readers, that it's low, I think if the data is incorrect, the question still stands. It's great then, it's great to get a handle on the data. Next to know, okay, how are they being handled? How are they being, outcomed? What's the review from the service user as well as the service provider in terms of staff feedback? So help us understand the data a little bit more. Really glad to have it, and then help us understand what action's being taken to resolve the alerts. Thanks, Jason. Thanks, Chair.
Thank you, Chair. Just a quick one, Jason. Where are we at now with those homes that were in special measures prior to COVID? How are we now chasing them back up again?
Thanks, Councillor Jordan. So this is in relation to care homes that are not performing to standard and to the quality that we would expect. So our quality improvement team had to cease direct visiting into the care homes that were rated as inadequate and requires improvement by the Care Quality Commission for infection control purposes. So we have been doing a lot of monitoring remotely and through third parties. The quality improvement team have now resumed visiting into the care homes and are starting to get back into those homes, looking at raising quality and improving standards. We're also aware that a small number of care homes that are rated good at this end of the pandemic have started to dip down and requires improvement. So we're working with some of those homes as well. So yes, the quality improvement team have resumed working into homes. There's been a programme of planning and work to achieve that, vaccination, extra training, extra precautions to be put in place, and trying to reduce the amount of footfall of the team across various sites and so on. So they're doing it in a safer way as they possibly can.
Yeah, I think probably quite a few of us are aware of homes that during the past period have been certainly causing concerns and issues that have come to light through families and their concerns about their loved ones and how they've been treated. And I know all of that information, I'm sure, from all of us who've received it has been passed on. But these are sometimes care homes that have not previously been regarded as falling below standards, but now appear to be definitely raising concerns. So can I ask that we are on top of those as well, please, Jason? Yeah. Okay. Right. Anything else on this report? Anything else for Jason? No. Again, same comment. It's a fairly quick discussion, but we do appreciate these reports and we do read them, and they are absolutely invaluable in terms of helping us to understand as a committee just where we are, what's actually happening in the services, and they are absolutely vital. Have you got your hand up, Councillor McLaughlin, or are you just... No, you're not. Okay. Right, so can I just thank you again very much, and all the team, Jason, for that report. Excellent. Really detailed. Yeah. Mover and seconder. Oh, come on. Councillor Frost. Councillor Cott, yeah, thank you. Right, and that takes us to item 16. Which is Julie Webster on looking at the tackling health inequalities. This is your employment report.
Thank you, Councillor Nolan. We know that being in good employment protects health, while unemployment, particularly long-term unemployment, contributes significantly to poor health. And I think if I reflect back on the report that I brought earlier to the meeting around the investment we're having around drug misuse, we know that there are really strong connections to the problems we've got there with the major unemployment issues that this borough had, certainly back in the 1970s and 80s. So we've got long-standing challenges, yes, again, with regard to unemployment and health-related worklessness. We have had some success, though, in supporting people into the borough, but you'll all be aware that we've still got very high levels and that our rates exceed national and regional rates. And that the pandemic, as with many things, has further highlighted the need to really focus on work that supports people to enter the job market, and particularly to enter a job market with good quality employment opportunities. This report is for your information and for you to note. It outlines the work that's taking place in the Council to address these issues, with particular reference to Connect Us and Reach Out, which I'm sure some of you are very familiar with. It's come here to illustrate how the public health and the regeneration teams are working together to ensure good quality work opportunities. And I think this is extremely important because of the significant regeneration agenda that we've got within the borough. I want to see the work around good quality work being equal to that physical infrastructure that we're wanting to see within the borough. And that's certainly something we're working very hard with the Regen team on. So the committee is asked to note the information included in the report. This report will also be going to the Health and Wellbeing Board and other relevant council committees to make sure we see that read across between what we call the people and the place agendas. Thank you, Chair.
Thank you very much, Julie. I think it's absolutely essential. And I think the reports like this actually highlight for us what we can do as a whole council, rather than just looking at what we do as a committee. We're just one small part of this very large operation. Yes, Councillor Volk, I can see you. And there's so much that we can do when we all work together, when it actually reads across. And if you look at the Wirral plan and how we all link into that, the work of Regen, the work of our leisure strategy, all of those things all come together. And it's really, really important that we don't lose sight of that. Councillor McLaughlin.
Thanks very much, Chair. And thanks very much for the report, Julie, which is really, I suppose it's stark and it's startling in the figures that are in there, but it's also good to have it brought to committee. So thank you for the preparation of it and for bringing it to committee. I think the word that's the most important in the whole report is good, when it placed ahead of the word employment, because we do know that so many people, when I look at the figure of people claiming universal credit, 31,000, that's people living in with low incomes, and a lot of those will be in work. I'm sure the figures of in-work benefit that are in there, can't immediately see them, but a large proportion of those people claiming universal credit and living on low incomes are in work, and it isn't lifting them out of poverty. So that is something that we should really be considering. What I've been asking for some time now is that we have all council departments, all council committees pulled together and get an anti-poverty strategy, which we don't have. There is some marvellous work going on in the community and voluntary sector to support people who are living with the impact of poverty, but there are other aspects of poverty that are not addressed by simply providing food, and that is housing. We've got a large stock of housing which is well below the standard which people should be living in this day and age in this country. There is not as much preschool engagement for children in the most deprived communities as there should be, and children who are living in the most deprived communities find it much more difficult to attain educationally and therefore develop the means to lift themselves and the next generation out of poverty. So from this, I hope that you said it's going to Health and Wellbeing Board, and I welcome that. Is it going to P&R? Because I'd really like to see it go to P&R and some sort of a recommendation come out of P&R that the mechanism for developing an interdepartmental and inter-partner anti-poverty strategy comes out of that. Thanks.
Yeah, I think that's going to be very important. It is coming to the Health and Wellbeing Board, which is actually a vehicle which could pull together across all council areas in terms of that anti-poverty strategy. Absolutely. To progress it, to develop an anti-poverty strategy, because it is across Regen, it's across education, it's across early intervention, leisure, everything. Oh, and our external partners are on that board as well. So we've got all our health partners on there, which is really important, and our police partners and our fire and rescue partners. Everyone's on there. Yes, thanks very much for that, Jodie. I would agree that the figures are stark and quite shocking, and there is little doubt that employment per se is not quality employment. We know how many people are on 0 hours contracts and have no idea whether or not they're going to get a wage packet the following week. And that's not employment. That's not satisfactory work for anybody. So it's about quality employment. That's really going to be really, really important. So thank you very much for that, Julie.
Yeah, thank you, Chair. So I won't go through the report. What I will do is I thought I'd just focus on the latest data that we've got with regard to COVID, because as we all know, it's a very fast-moving, likes to throw lots of challenges at us. So unfortunately, within the borough, we've seen an increase in cases really from the 20th of May, when we were down to only 15 cases in the last 7 days up until the 20th of May. So we were seeing about 3 a day. On the 4th of June, we've had 153 cases reported in the last 7 days. So I've actually been on holiday. Well, I say that, I've actually just not been at work. But our rates went from 4.6 per 100,000 on the 20th, they're now at 47.2 on the 4th of June. Now, they're not the rates that we're seeing in Greater Manchester, in places like Bolton and Blackburn with Darwin, but as we all know, these are the sort of the warning signals that come our way to say the virus is definitely out there and it's circulating. So we've got an increase in cases. Those cases are particularly in our younger age groups, 30 to 39-year-olds and the 10 to 19s as well. We haven't seen a subsequent big increase within hospital, and I think with hospital admissions, we have, on the 4th of June, we had 2 patients in Arrow Park, both of whom were in ITU. So I think what we're seeing here is the vaccination programme absolutely playing its part, particularly with our older, vulnerable patients within the borough. So they're not catching this virus, but those people who are unvaccinated and our younger age groups, obviously now we're all mixing more than the virus is doing what it does. It mixes and it infects people, particularly those who aren't vaccinated. So not got the big pressure on the acute NHS sector that we saw back in January and last year, but we are starting to see outbreaks in schools. Not because the school is an unsafe place, but because the school is just a reflection of what's happening in the community. So if the virus is circulating in the community, then obviously the young people will take it into the school setting. And I'm expecting to see more outbreaks now that the schools are back after half term. We've also got outbreaks in hospitality settings as well. Again, our hospitality sector is working very hard with us. They've put lots of measures in place, but this is a very virulent virus. And the variant that is circulating now within the borough is the Delta variant that was first identified in India. So I think this next phase of the pandemic will very much be one of disruption to the local economy, particularly hospitality, and disruption within schools as we ask bubbles to self-isolate, and then that impact that has on parents and carers. It will also obviously have impacts around workforce as parents and carers need to take time off to look after their children. So from a public health perspective, any further relaxation of the roadmap will add further pressure on our case rates. And so, as I say, I think this next phase of the pandemic will be different, and I think the impact will be more on schools and on our economy. So from my perspective, the continuation of the hands, face, space messages, more flexibility about vaccination delivery. Great to hear today that the 25 plus will be invited for their vaccination. And I'm afraid I've also some more update around care homes, Jason. sorry to say that we have seen some outbreaks in care homes. This is where we've actually, because of the care home testing programme that we've had, we have got people who've got COVID. They haven't got symptoms, but because we're testing, we know that there's COVID there. But because they've been vaccinated, they're not poorly. So the vaccine's doing its job. It's a bit of it's a complex message, isn't it? Vaccination, really, really important. Let's keep on doing it. Let's keep on pushing it. But let's not take our foot off the gas with regard to all the public health measures. And that's why we're all sat here with face coverings on and a long way from each other. So thank you, Chair.
Thank you, Julian. It is obviously concerning. The overall message that I take from that, Julie, is you're not to go on holiday again. Look what happened when you went on holiday. Seriously, actually, reading through this report and in the rest of it, I know you've talked to us about the current situation, but actually you read through and you read all of the measures that we're taking. I think it's a really good comprehensive picture. The things we're doing around testing, the things we're doing around compliance and enforcement, the things we're doing around outbreak management, support for self-isolation, contact tracing. There's a huge range of activity that's going on around this management of COVID. And I do think that we're doing well with this. I do think that the work that Julie and her team are doing is effective. I think I dread to think what it would be like if you weren't undertaking all of this. And it is good to see things like testing. I know there's problems in terms of testing because I know that the feedback from people is, again, it's this complex message, isn't it? They're being asked to test and the response is, oh, it's all right, I don't need to have had my 2 vaccinations. And actually people don't get the message that they can still have COVID and can still spread it. Because I'm aware that of the case last week, I think, Julie, when you gave me the figures, was it we had 100 cases or something, and of those, only a third were symptomatic. The other 2/3 had come to light through testing. They had no symptoms because they've been vaccinated. So it's really important to get that message across to people who have had the vaccination but still must get regular tests because you can still catch COVID. You just don't know you've got it. And that's an essential message we have to get out there. And that's a real job for comms, I think. And for all of us as local councillors as well, a really important message to get out there to people. Any other comments? Questions for Julie? Phil?
I think my observations are linked to very closely to what Councillor McLaughlin was saying earlier about low pay in the borough and the claiming of universal credit. At the moment, the maps on Public Health England, looking at the 43 super output areas, don't show a particular link with deprivation in parts of the borough. Just 1 or 2 places that I've been looking at that are more interesting and which no doubt something can be shared confidentially at some point. But the worry that people have in places about low wages, reporting themselves as being unwell, staying off work, the ability to get support, financial support, rather than carry on going into work for fear of losing job or for fear of losing hours of pay and for having less income, that seems to me a key driver in many areas, and it's a background worry. Now, this report does talk about this tranche of money we've got for next March, talks about keeping steps, the COVID hub in place till next September 2022, a whole range of things that we can see that as a council, as an area, we will have to keep working through for the next 15, 18 months, whatever it is. But the underlying worry they always have was that in areas where there's densely packed housing and people are sharing houses and multiple occupation, or people are working in workplaces where they're fearful for their jobs and finances, there's an underlying risk there that I haven't yet found a way of breaking that circle, and I should think professionals haven't either, but it's something that we have to, through our channels, keep impressing upon the government that until there's a scheme that supports people to stay off work, isolate themselves, and do that without fear, then we probably will keep re-entering difficulties.
I absolutely agree with you, Councillor Gilchrist. The self-isolation issue, and particularly for people on low wages, is a major problem. I think, yes, lobbying, please, but also the work we're doing locally through our community connectors, so that we're getting close to the people and understanding the problems, and therefore enabling them to make the connections to the offer of support that's available, is also a key part of this. You know, we've used some of our COVID monies to increase the number of community connectors within the borough, so we've got them across all wards now, not just on the east side. So, you know, that peer support and that peer and listening to what local people and their concerns are very much part of our local response. Thank you.
Absolutely echo those concerns, Councillor Gilchrist, without any doubt. So, Councillor Frost.
Thank you, Chair. Julie, the point you raised there in terms of the issues that people on low wages would face if they are self-isolating, you prompted a question. I'm aware that there is a pilot scheme that's started at the beginning of May for 40,000 people who aren't self-isolating, but they are test and tracing. I know that Cabinet member Michael Gove, after his holiday to Portugal, is not having to self-isolate himself, but he's now apparently part of this scheme. Do we have any members or any Wirral residents who are part of the scheme, and particularly any residents who would actually need to not self-isolate due to low wages?
We don't know directly, we haven't been informed, but we do know of some, because we've been in touch with some people about it, but that's all been done nationally, and we haven't been informed who those individuals are.
And sorry, follow-up question. Thank you, Chair. Why would you not have that information from government? That seems quite critical for you and your team to have.
Yes, it would be useful to have that information, most definitely. I think it's because they're trying so many different things to try and see how does test and trace actually work, and how can it work effectively, that they're actually looking at this as part of a research project, and it's about people's compliance and behaviours, etc. So it's being seen and run down a evaluation research route rather than connecting into the local system. Because these people they should still be following all the rules and regs. So long as they're doing that, that's the main thing we need them to do.
Thank you, Julie. I think it's unfortunate that you aren't shared, that data's not shared with you. Unfortunate, use that term lightly. Thank you.
Any further questions? I would agree that it is unfortunate we haven't got. Yes. I would agree it's unfortunate we don't have that information. Certainly ought to have. Councillor Jordan.
Thank you, Chair. Julie, one of the things that has plagued us on planning is HMOs. We're very reluctant to pass them, but planning law insists that we do if they fall within planning law. Is there some way we can think of going forward that would say that really these are not suitable given the current situation with COVID, and it's endemic now, it's going to be with us for a long time to come, and actually put in place a better way of housing for some people who at the moment are sharing facilities, which is only going to spread the disease further.
We are working closely with the housing team, and obviously we have the Healthy Homes initiative, which is funded through the Public Health Grant. I think there's always more we can do in this field, so I'll take that question away and just make sure that we are making those connections, particularly around HMOs. I just wonder if I can just come back on Councillor Frost. Councillor Frost, I don't think I answered that question correctly. We will know about the cases because we get all the case data. What we don't know is whether they're doing the test to release, which is what the cabinet member's doing. So we know about the case, so we will have been in contact with them, which is what happened to say, you know, you're a case, you know, you need to self-isolate. And that's when we were told, no, I don't, because I'm on the test to release programme.
Thank you, Judy. No, that's helpful clarification. And I think to Councillor Jordan's point, you know, given some of the issues that we face on other committees in terms of trying to make sure that our residents have the best overall quality of life, information like that would be really helpful to us, particularly as we're on subcommittees in terms of informing our planning framework to help us understand, okay, well, how can we best protect people as a whole of life in different committees? So information like that, I think, would particularly help you and your team, and then this committee, but also, you know, the wider committees that we sit on. But thank you for the clarification.
Anyone else? Any further comments before? Right, I'll ask for mover and a seconder for those to note that report. Councillor Frost, Councillor Cannon, thank you. That takes us, finally brings us on to work programme.
Thank you, Chair. This is a standard report that you see each time, setting out the reports that are expected for the next meeting, the meeting after that. However, thank you, Daniel. You'd think we'd get used to it, wouldn't you? However, given that we've got a July date now that wasn't in when this work programme was put together, what we will need to do is review and see which reports can come forward to July, or need to come forward to July, and which other reports need to be added for the July committee. So this work programme is under review on the basis of the additional meeting that we now have in place.
Yeah, thank you, Graham. I know one of the comments you made when we talked about about having a July meeting was that you already had something like 15 items for September committee, and that was now. That's before anything else happened. So that was one of the reasons we decided that a July committee would be useful. So, so obviously those items that are on there will all kind of shuffle up a bit now, presumably, and we'll see. Any comments on the work programme, or are we happy to note that? Yeah, we'll note that then. Move a seconder. Thank you. Oh, you've got a question?
It was just thank you, Chair. It was just, I think there was a discussion earlier around a workshop, so I don't know whether that needs to be added. There are a few workshops on page 253, so the addition of the discussed kind of immersion workshop, I think, would be helpful. Thank you, and I'll move it.
So yes, I'm told the workshops will be added in. Thank you. Happy to note. Move a seconder, please. Councillor Frost is moving. Councillor Cottier seconding. We said that there was nobody who wanted to comment or speak on the exempt items, but we still, Legal and Governance advised me that we still have to move the exemption at the end of the meeting, regardless. even though we're just going to formally move it and second it. I'm still going to close the meeting once we've done that. So I just need to, well, we've got those movers and seconders there, Vicky, okay?
It's the appendix to item 8, Councillor Gilchrist, as the Chair
Yeah.
says. There was no discussion on it, but just for the matter to remain confidential, we need to formally move and second the exemption.
Would have needed to say goodnight to members of the general public, but given that you don't, can I just thank all of you very much for your participation tonight? Can I thank the officers very much for the work they've done in presenting the reports? And don't think we've got any members of the public here, but I will formally thank them for their attendance. That will be recorded, for their attendance and interest in the committee, and also thank the staff here at the Floral Pavilion for their support for us tonight and helping to work with us to keep us safe as well.